Alright, so in this case we have this individual who has been with me for a few years now. In 2011, you can see his teeth, they had some stains and they were mildly chipped, but by 2018 the chips have gotten bigger, and it is at this point that he decided he wanted to get something done about it. But before we did something with the front teeth, however, we did tooth number 6. That's what originally brought him in, actually it was, a couple months ago. And he had decay on the distal part of number 6. We removed the decay and then built the tooth up and put a crown on it. After the crown was seated, that's when we talked about the front teeth, and that's when he decided he wanted to do the front 4 teeth. So you can see now we're ready to move on to the next step. So he shows back up, and we're going to go ahead and fill in the missing parts of enamel with composite, kind of do an in-the-mouth mock-up with composite. Then for prepping these veneers, we went ahead and did the vertical cuts. There's some people who do horizontal cuts, but it's just basically a depth gauge so that we can get the right amount of tooth enamel reduction. And now you can see it from the incisal edge to kind of get an idea of the depth. And then we're done. We have preps like this. The lab needs, of course, shade tabs for the finished product of what they're aiming for, but we also like to take prep shade photos, and I actually go ahead and take 2 photos when I do this because you'll notice that the metal tabs on the shade tabs can reflect the light back from the flash, and it can sometimes cause the actual resulting picture to be darker than it would normally be. So I always take 2 tabs. I always turn the tabs slightly from one picture to the next. It gives the lab a chance to see how these teeth look compared to the shade tabs. No one's a perfect match, and that's why we always hold up more than one shade tab, so they can kind of see across the spectrum where that tooth falls between, say, in this case it's like an ND2, ND7, ND5. We have all those different ones, but when you're doing the individual shades for the front teeth, or for any tooth for that matter, you can hold up 2 different shades, say an A2 and an A3, and you can see how does that tooth fall between A2 and A3. Maybe it's an exactly A2, and it kind of gives you an idea that it's not leaning one way or the other. It just helps the lab know which way to go with the case. And so we went ahead and made temporaries, and what you're seeing now is a picture of those temporaries in place the day we put them in. A few weeks later, the patient returns, and this is how the temps look, and more importantly, it's how the tissue looks. And you're going to see in the next couple of slides why that's important, because tooth number 7 does have an apically positioned margin, but that's because of the decay. If you remember seeing on the slides previously, that's kind of where it began. And to have the gums brought back down, that would have made the case ideal, but the patient didn't want to do any kind of grafting, and because of the restorative material that was there, it may really limit the periodontist's ability to do that. So anyhow, the final restorations are now in, and you can see the gum line is red up by the gum line. But I think it's going to play out just like the temporaries did, and it's going to resolve and get pink. It's just they got red from the cement cleanup during that seat appointment. And then of course we check the occlusion, and this is a big part of both the temporaries and the final restorations. Whenever you're looking at anterior, especially veneers on the upper, the number 7 and 10, or the lateral incisors, the distal lingual areas of those teeth, you don't want in occlusion. You don't want the restorations in occlusion. Often called these areas the occlusal kiss of death right there. If you leave that in occlusion, the patient will break that off. There's no question about it. It's just a matter of time, and usually a short amount of time before that actually happens. And so now you can see the comparison of the picture of the top versus the bottom. On the bottom picture, you can see that the markings are no longer there, and even check it with the patient moving into all the different excursive movements. No longer are they hitting on the distal linguals of those porcelain veneers. So in looking at this case, it is not ideal. Some of the things I would have done differently. Tooth number 11 and 12, they should have been actually treatment plan. I think they were actually treatment plan. The patient just declined to do them. You can tell that if the patient would have went ahead and prepped those teeth, it would have made everything just kind of line up and look more uniform as far as shade is concerned. Second thing is tooth number 6. You can see it looks like it's really wide. That tooth was actually kind of stretched, the porcelain, if you want to call it stretched, forward in order to meet the original tooth number 7. And so what should have happened is when I was prepping 7 through 10, I should have went ahead and shaved a little bit of that mesial number 6 to get it back to its more normal shape, and that way 7 could have filled in the difference going in that direction. And then, like I mentioned earlier, number 7, it would be great if the gum tissue was further down, but we didn't elect to do that in this case, and the patient's lip barely shows it. So all in all, he's very happy with the end result, and he will be wearing a night guard to help protect these teeth from wearing down any further. Anyhow, that's the case. I hope you enjoyed it, and look forward to seeing you in the next video. All right, thanks. Bye.